Hello and welcome back to the Digital Health and Wearables series. Today I have another magnificent episode and guest for you. But before I go ahead, let me remind you to subscribe so you get all the content and check out previous content. And also acknowledge our partners, the digital health platform CliniTouch V and our series partner Fujifilm. And today we have Ian Weissman. He's a physician and patient advocate. He's also a health equity and well-being champion. Ian is a radiologist at Milwaukee Veterans Affairs Medical Center. He's also the chair at the American College of Radiology Commission on Patient and Family-Centered Care Outreach Committee, and also the president of Wisconsin Radiology Society. Ian, how are you?
I'm fantastic, Joao. It's a real pleasure. Real pleasure. We've known each other for years on social media. I mean, it's so nice to be seeing you in person because you're in the UK, right?
Yes, I'm in UK, Ian. Yes.
And I'm in the United States. So the fact that we can talk across the world is quite a thrill for me. So
No,
I'm really
that's
excited.
brilliant. Well, first of all, I follow your great work. Also, we're very active on Twitter, and as you mentioned, I feel like I know you for a long time, and that seems to be the way now. I met a few people at IMS a couple of weeks ago. A lot of people that are new for many years, but we never met in person.
Exactly. And by the way, all your work that you're doing in digital health and digital wearables is so important. Thank you. I was just thinking about this the other day, but wearable health, wearable technology. I mean, in the pandemic, it's critical. We know that patients, when their oxygen levels drop, they need to go see the doctor right away. They have to follow is it 90%? Is it 80%? I mean, they have to be following it. So if they're wearing something on their finger, like a ring or something to monitor their biometrics, which is what you are working to develop and to help us, I mean, that's critical in improving patient health. I mean, that's one example. Another thing I was thinking about is in the UK, they have an implantable sensor, which you guys are doing in the UK, which is like an artificial pancreas, a sensor underneath their skin, which is going to be really life-changing for patients with diabetes. It can monitor the glucose level. So everything you're doing is so critical to improving patient care. So thank you. I mean, I really appreciate the work you're doing. It's helping us as a global health community.
Well, it's a joint effort. Me, you, and many others trying to push these agendas forward. So, but I appreciate that, Ian. Ian, I'm going to start with the questions. Is that okay?
Of course.
Brilliant. The first question that I have for you is: we are hearing a lot about health equity, and why is this so important?
Yeah, no, you're right. Health equity is front and center. In fact, on my Twitter page, health equity, I have at the very top, and we're seeing this now. Health equity, I think, stems from the fact that everyone is entitled to receive equal medical care. I mean, everyone is entitled to receive. It's a fundamental human right. When people get sick, they need to be able to see a clinician. They need to get health care. And as we reflect back over the years, one would think that by now we would have equitable care, that everyone would be able to go see their clinician and it would be equal. But it is not. It still is not after decades and decades and decades. And what's happened has shined a bright spotlight on this because people have died. We know that people in underserved communities, minorities, have not been able to receive the same health care, and that these people have died. And with 1 million people in the United States, over nearly 6 million people around the world dying, people are saying, we've got to do something. And that is why health equity has become such a big issue. We know that Black women, that their child care is not equivalent to people who are, for example, white. They're not receiving the same equal care, and that it's so serious that they feel that they need to see a Black physician to receive equal care. And this should not be the case. Black, white, it doesn't make a difference. Everyone needs to receive equal care. So this is super serious. And we're trying to address this through my organization, which is the American College of Radiology, among other organizations in the United States, I mean, and throughout the world. One thing that we have done recently through the American College of Radiology is we have formed what's called the Radiology Health Equity Coalition. And what this is doing is bringing together different radiology organizations and other like-minded organizations to be working together to try to solve these problems. And I'll be lecturing on this topic in a few months with my colleagues throughout the nation. what we've done is we're starting to develop grassroots initiatives, and we're starting to collaborate with other organizations. For example, there's a very powerful, impactful organization called RadAid. And what that does is they provide resources to communities throughout the world. Radiology help them with interoperability, image sharing, things like that. And what the American College of Radiology has done, I've collaborated with one of my colleagues in RadAid to form this initiative, which is going to be looking at underserved populations to make sure that they receive appropriate breast care screening and cervical care screening. Through this initiative, we're collaborating with private vendors to do this, and it's about empowering health navigators, increasing access to healthcare, making sure patients have transportation to take them to appointments. It's again the community working together. It's a grassroots effort, so super important. And there's active patient and family care initiatives underway through the American College of Radiology. We have developed a patient and family-centered care toolkit to allow clinicians to be more patient-centered in their practice, to allow patients to have resources. We're developing patient advisory councils because patients have to be sitting at the table to be able to let us know what care do they need, how can they help, how can we help them. We're leveraging informatics to make sure that patients have friendly reports so they understand when they get a report, what does it mean? What does this word mean? So we're trying to make sure that this is impactful, perhaps putting images so patients understand what they are looking at. All these things, when we look back at history, it's, we can look back at Hippocrates, who's regarded as a father of medicine, who 2,000 years ago, and this really wise clinician, he said, we can't be all-knowing. I mean, he recognized that. He said, as a physician, I cannot be all-knowing. That all I can hope to do is collaborate with my patients. If I talk to them and I listen to them, then I have a better chance of understanding what we can do to help them. And interestingly, after Hippocrates, medicine kind of shifted away from that. We became very paternalistic, very maternalistic. Clinicians are telling patients, you do this, you do that. And when patients wanted to speak, we didn't listen to them. And all this has only changed recently. It's only about 50 years ago that we have started to take a look at this, that it's become a more patient-centered. It has to do with history. During World War II, there were not enough clinicians to help patients during maternity care, so we asked them to step up and take charge of their care. Children's hospitals realized that when patients were involved and families were involved in their sick children's care, the patient outcomes were better. Harvey Picker was a very strong patient advocate, put together the Picker Institute, and we formed all these initiatives. The important thing is to have health equity. We need to collaborate with patients. We have to improve outcomes. We need to increase the clinical time we spend with patients. And when we do that, we know that clinicians' burnout decreases when they spend more time with patients rather than looking at the electronic healthcare record. All these important initiatives are going to be important to address this. And it's always important to remember, and I always emphasize this, that we have to remember that the patient is at the center of care. The patient is at the center of care. When we remember that, I think we can make some progress to address these issues. Thanks.
Thank you. And you mentioned so many important aspects, and also it's a very complex issue, but now it's very high on the agenda, as you know, because I think the awareness with the pandemic and everything else, everything is kind of more at the forefront for discussion. Yes. And also, you are a patient advocate, but only now we're seeing the patients getting involved, and more patient voices, and all these things are coming together very slowly but surely. So thank you so much for that amazing insight and very, very comprehensive overview.
I was going to say, you're spot on. I think if we're going to change healthcare, it's not going to be me going to the administration. It's going to be you and me, patients and clinicians, going together hand in hand to the administrators and say, this is what we need to do. You're right. When the patients advocate, when we help them advocate, that's how we affect change. Yes, spot on.
Brilliant. Ian, moving on to the second question. And the second question is, AI, artificial intelligence, or augmented intelligence seems to be in the news every day. And how do you see this affecting you as a physician?
Yeah, no, it's affecting me. It's affecting you and your work with wearable technologies. AI is in the news almost all the time. We see articles coming out every day looking at the whole gamut of things. And it's a very important topic. Clinicians, patients, we're all discussing this. We're all wondering, how can we do this well? We want to make sure we do this well. Interesting, at least in radiologists, as a radiologist, Jeffrey Hinton, who is a noted cognitive psychologist, computer scientist, he's noted for his work in developing artificial neural networks, or AI, as we think about it. He came out with a very inflammatory statement years ago where he said, AI, he said, will replace radiologists. And it's not just radiologists, it's other clinicians too. It's ophthalmologists, it's different things. But that's a big statement that went worldwide. It was like the shot hurled worldwide. And people got very nervous and very concerned. But as we've been discussing this over the years, and he's kind of come back on his statement here a bit, we're realizing that AI won't replace radiologists. But what is true is that AI will replace radiologists who don't use AI. As long as we're using AI to help us, we're going to be fine. And that's true for anything. We always have to be sure that we're using the emerging technologies, because emerging technologies help our patients and help us. So AI is already providing tremendous value. It's improving patient care. We know that. And there's so much knowledge. There's so much data in the world. It's overwhelming. The articles that come out every day, the research articles that come out every day. There's just so much information. And what AI can do is it can go through all the information. It can analyze patients, for example, at risk for certain diseases. It can detect early disease changes. We've used AI programs in ICUs and things like that. It can allow faster, more accurate diagnoses. I remember there was a case I read about not too long ago where in Japan there was a very subtype of a disease, and all the clinicians couldn't figure out what it was. But with AI, it went through all this data and actually came out with the right answer. So it can help with prevention, detection, diagnosis. It can help develop individual treatment plans because it can analyze all this data and make sure that the patient is getting the right treatment. So AI is extremely powerful. From a patient and family-centered care point of view, it provides patients with information, education. There's smartphone applications. There's smart chatbots. There's wearable technologies, your area of expertise, which is improving digital health. So AI is very powerful. But I think we have to kind of back up a bit, and it's still it's a bit of an unknown for us. I mean, it's a black box. What is in this black box? We can't see what's in the black box, right? All these movies have come out about AI and things like that. So I think as a community, as a healthcare community, you and me and patients, we have to be careful in designing AI. We have to look at patient safety issues. We have to make sure we eliminate bias, health equity again. We have to make sure bias is eliminated in developing AI. This has to be a collaborative approach between patients and clinicians. Again, my organization, the American College of Radiology, has taken this very seriously. We have a data science institute at the American College of Radiology where we're looking at different AI programs coming out, making sure that they're doing what they need to do and making sure that everything is fine, because we want to make sure that this is helping patients. The Radiology Society of the RSNA, or the Radiology Society of North America, has just developed an AI course to help clinicians like myself, radiologists, learn about AI, because again, we need to understand this. We need to understand the emerging technology. There's many examples in my profession about how AI can help. We are seeing so many more images now in radiology than we used to see. If you look at a CAT scan, a CT scan, there's so many more images, and we need to detect these very small things. And AI can come in and look at certain things, look at fractures in ribs, look at little tiny lung nodules to look for cancers. I mean, it can do very specific information and help us to make sure that we're seeing everything, and perhaps free us up to spend more time to speak with patients, which is what we'd like to be able to do, because we know if we can interact with patients, decreases burnout, it helps clinicians, helps us. So lots of examples of how AI is helping. And I think the future of AI is very bright. As long as we're transparent, we design AI systems to put patients in the center of care, we're going to do great. We're going to be great.
Brilliant, Ian. Thank you so much, and thank you for refreshing me the memory around that AI statement. I'm in a kind of a keynote speaking circuit. I don't know who invented, so thank you for mentioning that about AI replacing physicians, but not the physician, but those that don't use AI. In other words,
Exactly.
it was very popular a few years ago before the pandemic. And
Yeah.
also the magnificent insights around the radiology and the AI, the combination. I wrote a book chapter on my vision. The combination of wearables and AI will be the true game changer in healthcare. And
Yes.
I think we're entering that phase now, only now. But yeah, very exciting days ahead.
I agree.
The third and last question that I have for you, Ian, is A lot of healthcare professionals are burning out. What can we do to stop this?
Yeah, this is really serious burnout, and we're also seeing this almost every day in articles and literature. It's really super serious, very sad. Um, I the almost every week I'm seeing this, and it's the numbers are really striking. What they're predicting is that a large number of healthcare professionals, our nurses, our doctors, uh, people who have helped us, who have helped our children, that they will be leaving the profession in the next 2 to 3 years. They're, the numbers are changing as new data is coming up, but I'm seeing upwards as 45% of healthcare professionals in 2 years will say, I'm leaving the profession, which is shocking, because for many of us, healthcare is a calling. I mean, we did this to help patients. It's part of who we are. And for healthcare professionals to be leaving the profession is saying that something really serious is happening, for these people to feel, for my colleagues to feel that they need to leave. And what we know is that the COVID pandemic and a lot of things we've discussed has just traumatized our colleagues, not just in healthcare, but patients, people in the community. It has traumatized them. And the healthcare workers, an article just came out last night talking about that they're suffering the same symptoms as people who have served in wars. Combat veterans are saving the same symptoms. I mean, this is very concerning. And what's happening is that these healthcare professionals are suffering what's called moral injury. It's called moral injury. And they're suffering from tremendous guilt because they've seen so many patients die. And for a clinician, we go into medicine to help people, and patients don't die. I mean, yes, patients do die, but in general, we're successful in keeping patients from dying. But when so many people come to the hospital because they're suffering from COVID and they can't breathe and they're short of breath and they're having heart attacks and all these things, it overwhelms the system. And healthcare professionals see these patients die who would not normally have died, which causes tremendous guilt for us, for clinicians, and it affects us, and it's cumulative, and it happens over time. And now we're seeing, after we knew this was going to be a problem, but now it's been 3 years and it's still happening. And healthcare professionals are saying, look, I got to leave. I can't take it anymore. And this is really, we've got to do something, and we are. The first thing is you and I, we recognize this. We know this is a problem. The next thing is we have to empower clinicians to be able to speak out, as you and I are doing right now. And there's initiatives underway to do this. The American College of Radiology has developed a Wellbeing program a couple of years ago. I serve in this committee with my colleagues. We have things which are, which can be done everywhere. Which, for example, we've incorporated the Mayo Clinic in the United States put together this Wellbeing Index. Very powerful. You can have it on your smartphone. It reaches out to you every month. And it says, answer these, few questions, not very many questions. And it tracks your behavior, how you're feeling, how are you feeling now over the past month? And if you notice that your well-being is decreasing, it gives you resources. It says, call this number right away, call these people right away. These are things we can do to just make sure that there's an extra layer of security around people to protect their health. The National Academy of Medicine in the United States is addressing this as well. Very powerful thought leaders who are sharing resources. I work for the Veterans Affairs in the United States, which is the largest integrated healthcare system. We serve veterans. This is our mission, and they just developed this national reboot task force, which stands for Reduce Employee Burnout and Optimize Organizational Thriving. And I serve on this national task force with colleagues in psychology and psychiatry and social workers, and we're trying to develop resources to help clinicians within our system, but of course we'll be sharing this with our colleagues throughout healthcare systems as well. So, what we have to kind of step back and say, what can we do as a community? We're a worldwide community. How can we help this? How can we help our colleagues? How can we help patients? And I think that certainly the most immediate thing and pressing issue is we have to work together to stop the pandemic. We have to work together to stop the pandemic. And we already have science to help us. We know years ago that vaccinations help against polio, helps against all these things, yet we have been very reticent to kind of do this because it's been politicized, which is terrible. Politics has entered medicine. We know if we get vaccinated, if we get boosted, if we wear a mask, I know it's very unpopular now for people to want to wear a mask, but it's just, you go into a store, you wear a mask, you leave the store, you take off your mask. Okay, if you can prevent your person who's checking you out at the grocery line, you help them, you help their family. These are all things we can do. We have to really remember, because it's become for a lot of us a lot of kind of this white noise, that 1 million people have died just in the U.S. Over 6 million people are dead now worldwide because of COVID, and the numbers will increase. So I think we have to see this as a community. We have to work together, patients, clinicians together. If we do this, I truly believe if clinicians see that patients are working with us, that everyone is concerned, is involved, that they will stay within medicine. But they have to see that. If they're not seeing a change, if it's status quo, we're going to lose half our workforce. And if that happens, we're in serious trouble. Okay, because people will be getting heart attacks and strokes and cancer. And if we don't have the clinicians to help us get healthy, you and me as we get older, our kids as they get older, we're in serious trouble. So I think that's what we need to do.
Yeah, Ian, thank you so much. It's a serious issue, as you mentioned. We are already short of good healthcare professionals, and the pandemic has been very traumatizing for many. And also, it pushed people to the limit. Working 12 hours, 14 hours, 7 days a week is not sustainable for any human being. We're not superhumans. We're not machines or robots. So it's a lot more to it. But you mentioned the pandemic. You mentioned the overall picture, the efforts that we need to come out as a community with healthcare professionals who support them and talk about these things, which you are doing, and we're raising the awareness. And I believe we are doing our part in this. Is all we can do. Ian, it's been fascinating. I truly appreciate you are here. We could spend 1 hour only on one question. It's so much to talk about. We came to the end of the episode, but I don't know if you watched it, but I finish all my episodes in a peculiar way. It's not really a question as such. It's called 1 minute of fame. So you can mention anything. You have so many professional accolades and you have an outstanding curriculum of as a professional, and you achieve many things. But you can mention anything: personal, professional, family life, anything whatsoever to round up. And before we go ahead, let me just mention that you were the American College of Radiology 2019 Physician Advocate of the Year. So that's one head start for you. But over to you, 1 minute of fame.
No, thank you. I would just say that you and I were involved in Twitter. We're involved in social media. You have a tremendous amount of followers. I have a lot of followers too. I would encourage people. I would encourage our colleagues, patients, to get involved with us on social media, to share ideas with us. I always make it a point when I put some information out about an article and a patient responds. I always want to elevate their voice. I want to make sure they're heard, because I'm always learning from them. I'm learning from you. We're learning from each other. So I would just say that if you feel that you want to make a difference, and it's so important to advocate for yourself as a patient, as a clinician, it's important to advocate for patients, that you should get involved in social media. It is so powerful. We've seen what social media can do, which is not good, okay, and put out misinformation, disinformation, but it can be a very powerful force for good. So I would just tell people out there, your voice matters. Get involved with us, you and me. We will make the world a better place through wearable technologies, through what I'm doing through my profession, and always feel that your voice matters. And I think if we do that, we're going to be great. So thank you.
Brilliant, Ian. What a great way to finish. I appreciate your time, your effort, your magnificent expertise and insights. Thank you so much for being in here with us.
It's my great pleasure. Great talking with you.
Thank you, Ian. I'm going to round up now. To all our viewers and listeners, make sure you subscribe to the channel. Also, I'm going to post Ian's Twitter and LinkedIn here. Connect with him. There was the invitation there, but also follow his great work. Connect with him, ask him questions, and also let me acknowledge our partners, the digital health platform CliniTouch V and the series partner Fujifilm Healthcare, and I'll see you all next week.